Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It's a special for me to be here to present my paper for all of you. Let me introduce myself. I'm SAFIRA Amelia, and I'm registered dietitian student in Gadjah, Mada, University, Indonesia. In this opportunity, I would like to present my paper with the title Anemia Status and its Association with Nutritional Intake, Comorbidity Index, and Characteristic Factors in Geriatric Patients, RSUP Dr. Sardjito, Yogyakarta. I choose this topic because all we know that anemia is a serious global public health problem that particularly affects from young children, pregnant women, until elderly. Anemia is a symptom depending on the decrease of hemoglobin and quite frequently diagnosed in older individuals. The etiology of anemia in geriatric patients is classified into nutritional deficiency, chronic inflammation, and unexplained anemia. This study to determine the relationship between nutritional intake, comorbidity index, and characteristic factors with anemia status in geriatric patients at hospital. The study used a cross-sectional analytic method at RSUP Dr. Sardjito, Yogyakarta along November 2021 until March 2022. A total of 68 patients complied for the inclusion criteria and were assessed from nutritional intake using the brief FFQ, as well as the comorbidity index and pre-treatment history using a questionnaire form. Data analysis includes univariate and bivariate. Bivariate analysis using chi-square test to determine the relationship between variables with a significance value of p less than 0.05. The result of this study are the prevalence of anemia in geriatric patients is 64.7%. According to the data on anemia characteristics, most of geriatric patients had normochromic normocytic anemia, which is equal to 63.6%. The results of chi-square analysis showed that there was a significant relationship between anemia status in geriatric patients with protein intake, iron intake, and tea consumption. However, there was no significant relationship between anemia status in geriatric patients with intake of vitamin C, vitamin B12, comorbidity index, history of hospitalization, and history of surgery. In conclusion, there is a relationship between protein intake, iron, and tea consumption with anemia status in geriatric patients at hospital. I think that's all from me. Thank you for your attention. And to end my presentation, I would like to close my favorite quote from Umar bin Khattab. If something is meant to go elsewhere, it will never come your way. But if it's yours by destiny, from you it cannot flee. Wassalamualaikum warahmatullahi wabarakatuh.